Okay, these are Module 72 notes. Starting here with evaluating psychotherapies and their prevention strategies. This really isn't about the therapies themselves. This is more about how well they work. So why do people really need therapy? Well, when we look at charts and outcomes after therapy, we find that most people, about 80%, tend to have a better outcome with therapy. This doesn't mean that people cannot recover from some illnesses without therapy. That is entirely possible. But we find that most people benefit from therapy. One of the things that we have to look at in the effectiveness of psychotherapy is perceptions. So the perceptions that we find is people often go into therapy with crises. So most people, when they go into therapy, they're at some point of crisis in their life. And once they basically seem to recover from that, many times they'll attribute that to therapy, when honestly, sometimes the crisis period is just over. So therapy gets some undue positive notes on that, just because people normally go to therapy when they have a crisis. It's kind of the placebo effect, and clients need to believe that it was worth the effort, meaning that many times therapy doesn't work overall if there's kind of a disbelief in some of the techniques. So if you're not willing to do some of the positive talk therapies and some of those other things, if they don't really think it's going to work and they don't use it, then obviously it's not going to have a positive effect on them. Generally, clients tend to view their therapist in a positive way for the most part. That's generally. We look at the therapist perspective, their perceptions. They find most people enter when they're very unhappy. It's normally that crisis point in their life. Something's happened. And when they leave, it's not that they're cured or that they will never be unhappy again, but they're a lot less unhappy than they were before. Now we have to look at research and all this also. So if we look at the outcome of research, we have the meta-analysis. Meta-analysis looks at many different research projects, puts them all together, and hopefully gives us a overall perspective on how therapy is effective. So if we look at the meta-analysis of many psychotherapies, this is what they've had come out from that. Those not going through therapy tend to also improve, but those that go through therapy, they improve more quickly than others, and they're less likely to be back in that situation. So let's take, for example, depression, because that's probably the most cliche and most known therapy in abnormal behavior out there. When we look at that type of therapy, it's possible that someone recovers from depression, but people that go through therapy will improve more quickly, and they probably won't be as depressed later on. If we look at some of the evidence-based practices, what many times they're trying to do, the APA, American Psychological Association, and others are trying to find the best decision-making when looking at therapy. What are the patient's characteristics? What are their preferences? What are their circumstances? What is the therapist particularly skilled in? And what does research say about what's effective? This idea of evidence-based practice is what's been really pushed to a lot of different modes in the psychology world. Okay, so moving on. There is some alternative therapies. Now, a couple things. This one on the top here is really popular right now. Eye movement desensitization and reprocessing. It's also called rapid eye movement therapy. the idea, this has actually been a lot of research put into from the military. The U.S. Army put money into finding some therapies that met with especially traumatic memories, traumatic events, the things like PTSD and other abnormal behaviors. But they've used this to basically take the person back. It's kind of the same thing as hypnosis in a way, the same basis, but of allowing them to go back to the traumatic memory, but giving them a safe and reassuring context, and also it gives them emotional distance. You're fine. One of the things that this does do, whether it actually works or not, there's also the placebo effect that has the part here where reprocessing some of that may not actually do anything in the brain, but it does something. I want to say in the brain as far as a scientific, but more of re-experiencing the traumatic event, so you desensitize yourself to it. There's also light exposure therapy. A lot of times this is used with a lot of what's called the happy lights or the vitamin D lamps. They're light exposure therapy, so basically it's a light that gives off vitamin D. It's supposed to be very close to sunlight, especially when we look at seasonal affective disorder. That's basically people that become depressed in the winter months. It does seem to affect the body's arousal and hormones and brain scans, considering light therapy and how it affects people. Now, if we look at some commonalities among them, we look across the board at psychotherapies as um, as a whole. We find that a lot of demoralized people, a lot of people that have been through a lot of difficult things, find hope. Many times they feel incapable of turning things around, and a lot of times this really helps their self-efficacy and self-esteem, puts them on the right track that a normal person would hopefully be experiencing. It also can give a new perspective. This is where the less opportunity for relapse really comes in, because people that have a new perspective on how to handle difficulties tend to not relapse into whatever abnormal behavior they have experienced. Now, if we look at some of the other things here, the therapist can give that empathetic, trusting, caring relationship that the person needs, that every person needs. This is where we have the Therapeutic Alliance. This Therapeutic Alliance is that emotional bond with the therapist. It's what every therapist attempts to establish between them and the client, but it's also really difficult to try to do that with hundreds of clients. So you can imagine the job of the therapist can be somewhat difficult, but it is effective for total recovery, having that empathetic and caring relationship. Now, some of the things that we find differences are the same in, we look at therapies. We find certain cultures seem to be alike. Sometimes one of the things that's a part of it is therapy being able to offer hope, increasing more openness, giving personal responsibility or a sense of purpose amongst people. But even though there's that therapy seems to have an overwhelming positive effect, there are some differences between the cultures. And this kind of goes back to individualism versus collectivism. In many individualistic cultures, they're more likely to seek therapy rather than a collectivism culture. They're more likely to seek an individual therapy rather than maybe group therapy, where you might see group therapy more a part of somewhat of a collectivist society. It's also very helpful if the therapist has the same religious beliefs as the client and can help the client overcome their problems with less difficulty. Now, if we look at some of the training, um, looking at like a consumer reports, we have the clinical psychologists. They mostly need a PhD or PsyD, which is more focused on therapy. Um, you have the psychiatrists; those are the more the treatment. They can uh, prescribe medications. They tend to be more difficult problems. Psychiatrists will normally deal with the ones that have they're either in diagnosis or with people with major abnormal behaviors. There's clinical or psychiatric social workers, and normally that's a 2 year after your undergrad. And then there's counselors. Many times counselors have a bachelor's degree, and some have a little bit extra, maybe a 2 year master's, but um, even like substance abuse counselors can even be less than an undergrad. Mostly it's an undergrad at a minimum. All right, so prevention of psychological disorders. Looking at a reactive side is what we mostly looked at, but we also have the proactive side. We find that resilience plays a part in this. So people that have resilience, they seem to have more personal strength, helps them overcome the trauma. Sometimes people have resilience after they've experienced some type of trauma. If we look at preventing um, psychological disorders, obviously there's the normal uh, health things that we can look at, like a healthy diet, um, having good relationships. But one of the things that we find with some psychological disorders is some of these are just responses to events. We can't change the events. You can't change things like war. You can't change the effect of things like rape on individuals. Some of these disorders are going to come as a result of that. Other things, as we know, are genetically predisposition. So it doesn't mean that, somebody eats too many candy bars when they're younger and all of a sudden they have schizophrenia or something like that. One thing we do want to look at, though, especially with all the um, things coming out now, especially in teens and adolescents, that the prevention of psychological disorders could be some of this either resilience or understanding of it. When teens or adolescents go through um, disturbing or stressful events, if they're taught to deal with that possibly in high school rather than when they're 22 or 30 and they deal with this something they've dealt with before but they've never really been able to overcome things, they've never been resilient, it's possible it has a greater effect than maybe if they would have been learned to cope with things when they're in their adolescence. All right, and that's all of 72.